Okay. All right, so like Rachel said, my name is Susie Thompson. I'm a junior at Forsyth Central High School this year, and I'm participating in the Honors Mentorship Program. So I've been shadowing Rachel and Angie since August now. And so I come every Tuesday and Thursday mornings, and my day could consist of anything from meetings or forums like these, a surveillance online, or isolation rounds. And so I plan to pursue a degree in global health leadership or public health epidemiology. So with all that in mind, here is my capstone. Oh wait, that was the slide. Okay, so the first thing that I had to do is gear my research towards an essential question. And so I came up with one, and it's, how may I implement infection prevention techniques every day? And so everyone, whether they realize it or not, is a factor in the spread or the prevention of an infection. And so obviously this could be at the most basic level, hand hygiene, or something as high-tech as disinfecting OR rooms in between patients. But I wanted a question that could be made personal to everyone, so everyone from a preschooler to a world-class surgeon can relate and reflect on this question. So finding answers meant establishing what I know already and what I need to know. So I didn't know much coming into this. I knew the basics of hand hygiene, and I had learned that in my food and nutrition pathway at school, just in regards to food handling and things. And I thought I had a pretty good idea of what someone with good hand hygiene looked like. They probably washed their hands before they sat down at a restaurant, didn't touch their face that often, always carried hand sanitizer, and that's basically all I knew. Everything else came from Grey's Anatomy, which probably isn't the most reliable source of information. But since I knew so little, I had a lot that I needed to know. And so there's no way around getting sick. It happens to everyone. And so two of the things that really sparked interest in me in this career would be, first of all, when I was in middle school, the Ebola crisis was going on. And so I found myself following that pretty closely. I didn't really know why. I thought it was just interesting, but I didn't think it was something that I could make a career out of. But the story of Kent Brantley really was interesting to me. So he was one of America's Doctors Without Borders. He flew to Africa while he's helping with Ebola relief. He contracted the virus. And then there was a lot of controversy over whether or not he should be flown back to the United States. But that's ultimately what ended up happening. He was flown back to the CDC headquarters at Emory University. And then the second thing that I really love is the hot zone. So I'm such a nerd. I read this for my summer reading project in my freshman year. And so I read it in like one day, and I've read it like 6 times since then. But it's so good, and it's just something, it tells a story of a true story of a highly infectious disease that originates in Africa, and the spread and this transmission from person to person, the stories behind those people. So I found all this information a bunch of different ways, but the first thing I did was interviewed Rachel. And so I asked her different questions about exactly how I get to infection prevention, or a career in that, and some advice that she would have. So she says that most people enter this profession, it's not usually their first step in their career. It's something that is a part of their first job, and then they develop and move into a full-time position. And then she says that in order to be successful, you have to look for infection prevention opportunities in everyday life. So when you're at the grocery store, in a public bathroom, at the movies, just living your life, look for ways that you can help to stop the spread of infection. And finally, communication is the most important attribute of an effective IP. And so just communicating your findings and will not only help the department grow, but the whole field grow. And then I asked her to describe a typical work day, which, as most of you know, there's no such thing in infection prevention. There's always something new to do, something new to educate on, something more to dig deeper into. Another thing that I started doing was reading different medical journals, and I had never really read highly intelligent works of literature before, but I found myself really enjoying them. So the first one that I found was about antibiotic stewardship. And so they were saying that these programs are necessary not because physicians and surgeons don't realize the effects that their prescriptions have on antibiotic resistant organisms as a whole. However, it's tough to break those prescription writing habits. So those programs are good and necessary to keep those physicians in check. The second one, at this time I was learning about C. diff and CAUTIs and CLABSIs and all those fun hospital-acquired infections. And so this journal assessed the morbidity and the mortality and the length of the hospital stay that's contributed to by an HAI, and it also gave 11 recommendations for infection prevention to reduce those rates, shorten hospital stay, and reduce morbidity and mortality. And the third one, I read this during flu season, so I figured it would be good to brush back up on my knowledge of flu prevention. This is something published by the CDC, and obviously getting your vaccine is the #1 way to prevent yourself from getting the flu, but just maintaining those good natural health practice habits would be a way to prevent that for yourself. So through all these methods, I discovered 3 main things. First of all, that competition drives results. So one of the first things that I did was talk to Carrie about the Clean Hands, Safe Hands competition that they were doing at PCU. And so they made up these punny names, and they were, their rates were through the roof because of the fun that they made out of something so mundane, as mundane as hand hygiene. The second thing I discovered would be surveillance, surveillance, surveillance. There's always something more to look at. It's really good to know what's going on in your house and how and that patients are being appropriately isolated and things like that. And then finally, the third thing, this is what Angie has ingrained in me, is that you inspect what you expect. And so the whole point of our isolation rounds or our environmental care rounds is to just maintain that level of excellence in our facility and to make sure that the staff is compliant with the education that the IP department has provided them with. So I just want to say thank you all for being my partners in education on this journey and allowing me to grow my knowledge of infection prevention. So thank you.